localized treatment, surgery, or doing an ablation procedure, it's the zapping thing, then we still need to make sure that we treat you and make sure that nothing else grows somewhere else.
Right.
First line treatment for anybody who has hormone positive breast cancer is still doing anti-hormone medication in the metastatic setting as well. So remember we talked about Verzenio before, in addition to doing your tamoxifen? That's first line standard of care treatment for women who have hormone positive breast cancer. It's not chemotherapy, which causes all the issues that you had before, but manipulating your estrogen and how your body sees those estrogen, because this is probably an estrogen feeding thing, same thing as what you have in your breast. But women can live long amount of time while being on anti-hormonal medication or anti-estrogen medication without having to do chemotherapy. So that's kind of the treatment. And I know you were a little bit hesitant to do estrogen before. The same conversations that we've had multiple times still holds true today.
Yeah.
So it's kind of sucky.
That low back pain was every day. As soon as I stopped it, it went away.
And we actually do, remember how we talked about stopping you from ovulating? When you're doing the Verzenio, we have to stop you from ovulating. And so we do the Zoladex monthly shots.
I haven't had a period still.
Yeah, you're still pre-menopausal. It's about a year, sometimes 2 years from the time that you finish your chemotherapy is when we say, okay, officially you're in menopause. So we still treat you
and then, no, she's not considered in remission, but like how long are you cancer free before you're considered in remission?
We normally say stable disease. We don't do remission. I don't like using the word remission because it makes you think this thing is never going to come back.
Right.
So, yeah.
Okay.
So stable disease or no evidence of disease is what we use. So. So
biopsy. Stopping my ovulation.
Remember how you were talking about, I want to do a hysterectomy, and I said, well, we can achieve the same process by giving a shot on a monthly basis so you don't have to go through a major surgery. We talked about that, right?
Yeah.
And then still doing anti-estrogen medication that's not tamoxifen, because you want to do a hysterectomy, you thought that was going to be enough anti-estrogen, and it's not, which we've discussed.
Yeah.
So when we use Verzenio or Ibrance, which are the same medications, work the same way, but we have to use it with anastrozole or letrozole. We can't use it with tamoxifen because the medication was not studied in women who were on
So now I wouldn't take tamoxifen anymore?
You would do anastrozole or letrozole.
So maybe the low back pain will go away then. Not come back.
Yeah, some women will have back pain. Some women will have joint pain. It's the small joints like your fingers and your ankles and things like that. Stiffness. If you sit for a prolonged period of time, it can cause muscle stiffness and joint stiffness. Not everybody experiences it. Some women do, some women don't. The Verzenio and Ibrance type medications also do that same thing. One of the side effects of those medications is diarrhea. So you do need to see a gastroenterologist to figure out why you're having the bowel issue before we actually put you on a medication that will definitely cause diarrhea. It does that for the first 2 weeks, 3 weeks when you start that medication. So if you're already having that issue, we need to have you see the gastroenterologist to deal with that. So we've got a couple of things that we have to do. We need to do the biopsy and see if the radiologist can biopsy that. That's done over here across the street.
Do we have to do the biopsy?
Yes. We need a definitive diagnosis that it is metastatic disease and not something else.
It could be a different cancer.
It could be a different cancer.
Could be, yeah.
It could be a different cancer. And so when I do this across the board, every single time somebody comes in with, they were doing okay, scans were good, and then there's something new that pops up on there. If we can get a biopsy, 100%, I'd like for us to get a biopsy.
So does that mean it went through her lymph nodes then, or?
Well, it's got it from the breast into the lymph nodes, into the bloodstream, and set up shop in the liver.
I read they call this METS?
Yes, metastatic disease, yeah. And so we have to do